Podcast 17, Week 19. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 19. Are you nervous about something serious happening during pregnancy? It's normal, and most women have few, if any, problems. But if you think something may be wrong, go with your gut instinct and call your doctor. He or she wants to know about your concerns so they can be dealt with if necessary. Your doctor wants you to call the office. Feeling dizzy during pregnancy is fairly common and is often caused by low blood pressure called hypotension. Supine hypotension can occur when you lie on your back, which is one reason we don't recommend it after 16 weeks. Your growing uterus puts pressure on blood vessels, which can cause dizziness. Postural hypotension is caused by getting up too fast from a sitting, kneeling, or squatting position. Cure the problem by always getting up slowly. If you're anemic, it can also cause dizziness. Your blood is checked routinely during pregnancy for this problem. Pregnancy also affects blood sugar levels. High or low levels can make you feel dizzy or faint. Eat a balanced diet, don't skip meals, and don't go a long time without eating. If problems persist, bring it up at a prenatal appointment. We're going to talk about thrombophilia now, which deals with blood clotting. First, let me say clotting of the blood is usually a good thing. It stops bleeding when you injure a blood vessel. When a clot is no longer needed, your body breaks it apart and flushes it from the bloodstream. Thrombophilia is a disorder that makes blood clot more easily or makes it clot too much or allows old blood clots to stay around too long. All can cause blockages in veins or arteries. Thrombophilia can occur in the arms, legs, or lungs. It can also affect the placenta during pregnancy. You can help prevent blood clots by getting regular exercise, drinking lots of water, and not sitting for long periods. You may also be advised to take certain meds or wear compression garments. If you do get a blood clot, treatment depends on where the clot is, its size, and other factors. Heparin may be the drug of choice, and it's considered safe during pregnancy. Complications from thrombophilia can recur in your next pregnancies. Preventive treatments include taking folic acid, a low-dose aspirin regimen, and using heparin. A friend experienced this problem, resulting in pregnancy loss. Before trying to get pregnant again, she took folic acid. When she did get pregnant with twins, she took heparin injections every day to keep the problem from recurring while she carried the boys. She had a successful pregnancy, and the twins are all grown up now. Do you use herbs and botanicals to treat various aches and pains or medical conditions? If you do, stop. Don't use any herbal remedy during pregnancy without first checking with your doctor. An herbal remedy may be okay when you're not pregnant, but it can be dangerous during pregnancy. Play it safe. Don't use any substance your doctor has not specifically recommended for you. Always check with him or her before you use or take anything. It's easier to ask beforehand than to worry about it afterward. Have you heard of hydrocephalus? It's a rare condition in which fluid accumulates in baby's skull, causing baby's head to grow very large. The problem is responsible for about 12% of all severe birth defects and may be associated with spina bifida and other problems. Hydrocephalus can usually be seen on ultrasound by 19 weeks of pregnancy. If it occurs, it's considered a high-risk problem, and the pregnant woman is often referred to a perinatologist for her care. Allergies can really knock you for a loop. They occur when your immune system reacts to various substances, and they can be caused by lots of different things. Nearly 10% of all pregnant women have seasonal allergies. If you use allergy medicine, don't assume it's safe during pregnancy. Ask your doctor about any prescription or non-prescription meds you use to treat allergies, including nasal sprays. Antihistamines and decongestants are usually okay to use for a short time. Ask your doctor which brands are safest before you use one. Under your doctor's supervision, you can continue taking allergy shots, but don't start them now. We just mentioned nasal congestion can be a symptom of allergies, but during pregnancy, it can be caused by other things too. Congestion during pregnancy is normal in many women. A pregnancy cause is increased blood flow to mucous membranes. Decongestants reduce nasal swelling by narrowing blood vessels in the nose. Most experts agree you can use Afrin as a very short-term relief to help reduce swelling and relieve congestion. For longer relief, talk to your doctor about using products considered safe during pregnancy. Some women wax their legs and underarms, want to know if they can continue during pregnancy. This type of waxing is okay and shouldn't cause you any problems. Do be careful waxing around the pubic area and avoid Brazilian waxes. If you're into the hairless body craze, you may use a depilatory cream to remove hair in the genital area. Be careful with these solutions because your genital area may be more sensitive now. In the past years, we've seen an increase in the number of single moms. Today, over 40% of all babies in the United States are born to unmarried women. If you'll be a single mom, it's important to have a strong support system. Seek support from family and friends. Childbirth classes are offered in many places for single moms. Many hospitals and birthing centers have options for single women when they give birth. Ask at your doctor's office for more information. After birth, you'll need support when you take baby home. You'll probably need the most help during the first month after birth. If you find yourself feeling apart from family and friends, make friends with other single moms. This can provide a support group for social interaction, exchanging childcare, and other tasks. One of the most important aspects of being a single mom is legal and financial protection for you and baby. You'll need many things in place before baby's birth. You may have legal questions about your situation. An attorney who specializes in family law can help you make a plan to protect you and baby. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.